Monkeypox antiviral drug put to the test in trial.
Combination polypill lowers the risk of major cardiovascular events, study finds.
Brain stimulation improves short-term memory in older adults for a month, study finds.
Alcohol, smoking, high BMI main causes of cancer in 2019, study.
Woman looked like a zombie after extreme reaction to lash extensions, sealed eyes shut.
Positive results for Pfizer vaccine against deadly respiratory virus.
Monkeypox antiviral drug put to the test in trial. The Oxford University team that discovered effective drugs for COVID is testing in the UK an antiviral called tecovirimat to aid monkeypox recovery. More than 3,000 people in the United Kingdom have contracted the monkeypox virus in recent months, with more cases expected. The virus, which is also rapidly spreading in other countries, has been declared a global health emergency. The infection usually clears up on its own, but recovery can take weeks and can lead to serious complications. The trial will include approximately 500 patients. Some will be given tecovirimat tablets twice daily to help them recover from the virus at home, while others will be given a placebo or dummy treatment instead. The researchers hope to have the results of the drug trial within months by comparing the two groups of volunteers.
Combination polypill lowers the risk of major cardiovascular events, study finds. A new study published Friday in the New England Journal of Medicine and presented at the European Society of Cardiology Congress in Spain found that older heart disease patients who took a combination polypill made up of 3 different medications had a lower risk of major cardiovascular events. The researchers, led by Dr. Valentin Fuster, director of Mount Sinai Heart in New York City and general director of the Spanish National Center for Cardiovascular Research, examined 2,499 patients in 7 European countries who had a history of type 1 myocardial infarction in the previous 6 months and were either over the age of 75 or a minimum age of 65, with at least one risk factor, such as diabetes or mild to moderate kidney dysfunction. Half of the patients were given the polypill, which contained aspirin, ramipril, and atorvastatin, while the other half received standard care. Patients were tracked for an average of 3 years. The researchers discovered 48 cardiovascular deaths in the polypill group and 71 in the usual care group, implying that patients who took the polypill had a 33% lower risk of cardiovascular death. Other outcomes studied in the trial, such as stroke or myocardial infarction, favored the polypill.
Brain stimulation improves short-term memory in older adults for a month, study finds. Scientists have discovered that by electrically stimulating parts of the brain, they can improve people's memory for at least a month. Experts discovered that volunteers performed better in word memorization games that tested both their immediate, working memory and their long-term memory. It's still unclear what the findings mean in real life. However, ideas range from assisting elderly people with memory loss to treating disease and assisting with exam preparation. Boston University's Dr. Robert Reinhardt described the stimulation technique as an entirely different approach to isolating and augmenting parts of the brain that offered an entirely new realm of potential treatment options. Participants in the trial wore a cap containing electrodes. A controlled electrical current, which feels like an itch or tingle, was then used to precisely alter brainwaves in targeted brain regions. The volunteers were subjected to 20 minutes of stimulation per day for 4 days in a row. Throughout the study, they were required to memorize word lists, which they were then asked to recall 1 month later.
Alcohol, smoking, high BMI main causes of cancer in 2019, study. A new study has indicated that nearly half of all cancer cases recorded worldwide in 2019 could be attributed to avoidable risks. According to a study published in The Lancet, a weekly peer-reviewed general medical journal, smoking is the leading risk factor for cancer in both men and women, followed by alcohol use and a high BMI. The study said that the leading cancers in terms of risk attributable deaths for both men and women in 2019 were tracheal, bronchus, and lung cancer. The study published last Thursday found that 44.4% of all cancer deaths and 42% of healthy years lost in 2019 could be attributed to preventable risk factors. The study noted that though risk-attributable cancer burden varied by world region and socio-demographic index, with smoking, unsafe sex, and alcohol use being the three leading risk factors for risk-attributable cancer. According to the researchers, reducing exposure to these modifiable risk factors would reduce cancer mortality.
Woman looked like a zombie after extreme reaction to lash extensions sealed eyes shut. The phrase, "no pain, no gain," is frequently used by beauty enthusiasts, but dealing with the consequences of a failed treatment can leave people feeling deeply regretful. One woman revealed a horrific allergic reaction to eyelash extensions that forced her to stay at home because she was afraid of scaring children with her terrifying zombie eyes. When Haley Fetzer, a teen from Ohio, US, booked her appointment, she had no idea how painful a simple lash treatment could become. Fetzer scheduled an infill, essentially a top-up to her fluffy lashes, a fortnight after a successful lash extension treatment. The young woman's eyes became troublingly bloodshot in the hours that followed, and she began secreting a goop every time she blinked. The 17-year-old's worst nightmare came true when she awoke the next morning to find her eyes completely closed, but that was only the beginning of her heinous beauty faux pas. Her symptoms worsened in the days that followed, as small broken blood vessels began to spread throughout the bottom of her eyes, leaving the young woman terrified that they would reach her pupils and cause her to go blind. Fetzer quickly requested that her lash technician remove the lashes the following day, a process that only added to her discomfort, as she compared the painful removal to being bitten by a million ants. Desperate for relief, the smoothie shop worker went to her doctor, who prescribed her a 5-week course of eye drops. However, while waiting for the medication to help her heal, Fetzer was left with bloodshot eyes, forcing her to become housebound due to shame over her appearance.
Positive results for Pfizer vaccine against deadly respiratory virus. Pfizer announced positive results in the elderly for a vaccine against the respiratory syncytial virus, for which there are currently no approved shots. The virus causes bronchiolitis, a respiratory disease primarily affecting infants but also posing a risk to the elderly, who can develop pneumonia. In an ongoing clinical trial, the vaccine is being tested on people aged 60 and up. According to preliminary findings, it was approximately 85% effective at preventing severe cases involving 3 or more symptoms. In the coming months, Pfizer plans to submit an application for the vaccine to the U.S. Food and Drug Administration, as well as to other regulatory agencies.
For your daily global health news, visit www.StayWellWorld.org. Please do well to subscribe, like, share and comment. If you've already subscribed, turn on the notification icon so you don't miss any update. Thank you for watching.